My name is Rebecca Blankenship, and I will be discussing impetigo for my 5-minute video. Impetigo is a common and highly contagious superficial intraepidermal infection that mainly affects infants and children. Impetigo usually appears as red sores on the face, especially around a child's nose, mouth, and on hands and feet. The sores burst and develop honey-colored crust. Impetigo is easily spread directly through skin-to-skin contact or indirectly by touching items such as clothing, sheets, or toys that have been used by individuals with skin infection. Indirect contact is a less common form of transmission. There are more than 3 million cases in the U.S. per year. Impetigo is a superficial skin infection caused by Staphylococcus and Streptococcus bacteria. Impetigo is most likely to occur in warm and humid environments, usually during the summer and fall months. It's more prominent in children 2 to 5 years of age. There are two types, non-bullous and bullous impetigo. The non-bullous is the more common form caused by Streptococcus and Staphylococcus bacteria. These lesions rapidly evolve to small blisters and then to pustules that finally scab over with a characteristic of dark or honey-colored crust. The bullous is more common in newborns, and it is caused only by Staphylococcus bacteria, and they look like round blisters, or they're called large flaccid bullae. These are a lot of times found around the buttocks, where the diaper is. In newborns, children, or adults who are immunocompromised and or experiencing renal failure can develop into a more severe and generalized form called staphylococcal scalded skin syndrome. Those that are at risk are those that are in daycares or schools, and there may be mini epidemics in daycares from the impetigo. Children and the adults that come in close contact with infected persons, those in a hot, humid environment, minor trauma, insect bites, breaches in the skin, family spreading, playing certain sports such as football, wrestling, poor hygiene, poverty, crowding, poor health with anemia and malnutrition. Some questions that you ask for a workup would be: what type of environment is the patient exposed to, such as daycare or schools, having skin irritated by other conditions, such as shingles, or just a dermatitis. Does the patient play any contact sports, football, wrestling, or are participating in activities that involve skin-to-skin contact? Being in warm weather, being in crowded environment where bacteria can spread easily. Physical examination would consist of looking at the area of the skin, looking for the honey-colored crust. That's the most common characteristic. And usually is frequently found on the face, around the mouth and the nose, or at the site of the trauma. Weeping, shallow red ulcers, pustules. Patients may also describe the lesions as very painful. Some teaching would be good hygiene. It can help prevent the spread of impetigo and to get rid of it. These methods include washing hands regularly, bathing or showering regularly, cleaning and covering any injuries to the skin, using antibacterial soap to wash hands, using a clean towel or fresh paper towel to dry body or hands, washing linens, clothes in hot water, cleaning surface areas in the home with antibacterial products, keeping fingernails short, avoiding schools and child daycare centers while infection is contagious, and not sharing personal hygiene items. Impetigo is easily treated. It's with triple antibiotic ointment or mupirocin, done 3 times a day, and then also the patient needs to remove the crust and then clean with gentle washing 2 to 3 times daily with antibacterial soap. And if it's not clear in 7 to 10 days, then they will need to come back, and the lesion will need to be cultured, which is by taking a swab and running over the lesion. And this concludes my 5-minute presentation on impetigo. Thank you.